I'm in Epsom, South London, where protesters are fighting to keep Epsom Hospital's threatened acute services. Under the Improving Healthcare Together plans, which were approved in July, a £500 million investment will see major acute services relocated to a new facility in Belmont, Sutton. I ask NHS campaigner Colin Crulley what this means for Epsom.
The NHS has basically been shrunk on a national level, and locally that means that St Helier Hospital in Carshalton and Epsom Hospital here both face losing their A&E, maternity, intensive care, cancer care, coronary care, paediatrics, and literally hundreds of beds. They are going to build a new facility in the Belmont area, but we don't know when that will be. The two hospitals that we currently have that should be invested in are going to be downgraded, and the people who live obviously close to those hospitals are going to suffer.
Of the £500 million package, at least £80 million will be invested into Epsom and St Helier hospitals. But as protesters marched towards the town hall, they were calling on councils to reject the new plans.
Well, Merton Council have actually rejected the plans and have asked them to be sent back to the Secretary of State for Health, which is good. The reason they're objecting is because they want the new facility to be at St Helier site. But what we are asking for is that both the hospitals should be protected. It shouldn't be a case of one or the other. What we're hoping is the other councils do likewise. So that's Sutton, Kingston, Wandsworth, Croydon and Surrey. There are voices in those councils that actually oppose the plans, but they haven't actually come out officially and rejected it or opposed it. We're here today obviously to protest against the cuts, but also to put pressure on Epsom Council and Surrey Council to look at the plans, see how flawed they are and reject them. So there's been hardly any scrutiny until this point. Yeah, according to the Trust's own findings, I think it was around about 45% of the public hadn't actually heard of the plans, which is appalling, because it's called Improving Healthcare Together, which is anything but. What they're actually doing is they're shrinking the NHS, they're reducing the amount of major acute hospitals in the country from somewhere around 200 now to anywhere between 75 and 44. Not only do we have to reject these plans, we actually have to be honest about what they are. They're shrinking the NHS, turning it into a system that resembles the United States. It's an assault on the NHS. It's been going on for about 40 years, and if they were to say honestly what they were up to, the public would be outraged. They don't, they lie, and these plans are a PR exercise to try and get us to accept less, and we should be against it.
Reject IHC! Reject IHC! Reject IHC!
Campaigners from the pressure group Epsom Hospital Save Our Services think the public consultation process was inadequate and cite the hospital's close location to the M25 as reason enough to keep its emergency and acute services.
We live in Fetcham, and we don't think there was adequate consultation. We never received anything in the post, and the first we knew about this idea of a third hospital was about 4 weeks ago.
We want our hospital to retain its status that it had 30 years ago, with full A&E, full acute services, and we don't want any services at all to be moved out of Epsom Hospital. We don't need a third hospital to be built. We think that Epsom, with good investment, can serve as a centre of excellence in the area, especially taking into consideration the fact that it is the closest hospital to M25, and I think the council misses this very important point. We will continue fighting. We will be writing to all the local councils to demand them